Hello, wonderful people. Welcome to my channel. Today's discussion will be based on asthma, and I would like to address it more than discussing it. A parent suggested the topic, and according to her, she was in pain, all because her child is asthmatic and the child feels like no one understands her condition, especially among her peers. And by the end of this, I hope you all understand her condition. Talking about asthma is a chronic inflammatory disease of the airways. When we talk about airways, we all have airways there that we breathe in and out through. That's our airway. So through the airways, we have bronchia or windpipe, which gives branches, small branches. We call that one to bronchialis. What happened is through that bronchia or the windpipe, there can be swelling of the smooth muscles. The muscles within it will swell, or there can be hypertrophic of the smooth muscles, increase of it, which will then cause hyperreaction in terms of any trigger or any stimuli. It will cause hyperreaction, which will be producing more mucus, and that mucus will plug, and already it is enlarged, like there is hypertrophic of the smooth muscle. In addition to mucus, that means there will be obstruction. So due to chronic that obstruction being within the windpipe, it will then not pave way for normal breathing in and breathing out. So we all need oxygen from outside within, and we need to exhale or take out carbon dioxide. Without that action, in and flow, you will find it difficult in breathing, or it's not easy for you to survive. That's how it is. But for people having asthma, their windpipe is already inflamed and there is hypertrophic of the smooth muscle, which do not even give them access of breathing in and breathing out. So the, let's say the diameter, the normal diameter is narrowed. That makes it difficult for the oxygen to get in and carbon dioxide to get out. That's how it is. So take note of it. But under normal circumstance, breathing in, breathing out should be the process. Talking about causes can be of heterogeneous diseases. It can be that there is viral infection which has caused as a result of not well being treated, or although it was well treated, but the severity was very high to the extent that it has caused distraction to the smooth muscle, and it has caused narrowing of the diameter, which has also caused brain hypersensitivity, producing more mucus and plugging and causing obstruction to your air pathway. Or it can be that genetically you inherited it from your parents. Yes, they are already asthmatic patients, and you too, they gave birth to you and you inherited it from them since you were made from their DNA. And it can be that environmentally you can also have some stimuli which will cause such incidents occurring, like allergens, air pollutions, environmental chemicals. Anything that will cause stimuli to your pathway can also cause asthma. Let's talk about symptoms of asthma. In terms of asthma, they easily cough, especially when they come across any of their stimuli or anything that would trigger their episodes. They cough easily, and because of the obstruction or the narrowed of their diameter of the smooth muscle, they find it difficult in terms of breathing, both breathing in oxygen and breathing out carbon dioxide is not easy because of the obstruction, and they feel chest tightness, like they feel heavy in their chest. And when there is even an episode of their attack, that smooth muscle continue inflaming, like it gets inflamed more and swell, become very large, which will then cause hypersecretion of the mucus. And the mucus is very thick, like they produce thick mucus, which all coming together to cause obstructions. So it's not easy for them at that moment. Even those severe ones, you can see that their skin around their nose, their mouth has changed to a bluish color, like cyanotic, which shows that there is decrease or they lack oxygen. They need oxygen at that moment. So it's not easy. Just put yourself in their shoes. You cooking in the kitchen and you forgot, all of a sudden you started burning, everywhere has been dark. You getting into the kitchen to switch off the cooker, it's not easy for you. You can't stand, you start coughing. That irritation is what asthmatic patients they go through if you come across any, or they come across any stimuli or triggers. So we have to put ourselves in their shoes sometimes. Don't think they are dictators. People think they are dictators. They want to dictate of the kind of perfume you should use or the kind of activities they will do. They decide for themselves. No, it's their condition which is deciding. They are just asking for mercy and not dictating for you. So take note of it and consider them sometimes. And comparison, people also compare other asthmatic patients to others by saying, I use this perfume and this is asthmatic and person is able to stand. We will talk about it, although they are all asthmatic or it's asthma, but it's of different variety. Just like ice cream, we have ice cream, all is ice cream, but we have different flavors. Like we have vanilla, we have chocolate, we have strawberry, but at the end of the day they are all hot ice cream. That person's stimuli or the trigger may not be of that strong scent or the spray, but the other one's own will be that one. So take notes and have mercy of the asthmatic patients.